Welcome to today's Dentistry with Dr. Blanche Grube. The goal of our program is to educate you, the patient, in all aspects of the Grube-Huggins Holistic Dental Protocol. On this installment, we're discussing the biological difference. And now, here's Dr. Blanche.
Hi, I'm here tonight with one of my colleagues, Dr. Derek Grieco, who is one of my colleagues in Centers for Healing. In previous lectures and videos, I've talked to you about Centers for Healing. These are centers that I have established with my other colleague, Dr. David Villarreal, and we decided what the United States really needs is a series of dental centers that are committed to practicing dentistry following the Dr. Huggins protocol. That's Dr. Hal Huggins protocol. Why are we so committed to the Dr. Huggins protocol? Simple. It works. It works, and it's the safest way to go, and that's why we do it. So, hey, Dr. Derek,
right.
How are you?
Great. Glad to be here.
Good. Dr. Derek is from the Pittsburgh area. People ask me where am I from. Of course, I always say I'm from Brooklyn, but I've actually been living in Scranton, Northeast Pennsylvania for 34 years, so I guess you could say I'm from Scranton also. I'm from a lot of places. I wanted to talk a little bit tonight about biological or holistic dentistry. Why is it different? What are the differences between a conventional dentist and a biological dentist? And yes, I know I'm going to offend some conventional dentists. And they're going to get mad at me and they're going to say, that's not true of all of us. So let me be right up front and say, right. Yes, it's not true of all conventional dentists. But some of the things that we're going to say here tonight are true of a lot of conventional dentists. So with that being said, you need, as a consumer, to be very careful. So what are the differences? Well, number one, most of us do not have a local practice. We may have some local patients, but the majority of our patients come from far away. 95% of my practice comes from out of state, out of country. We've had people from as far as Saudi Arabia, Australia, Japan, coming to get our work done. Well, that alone makes it very different than a conventional dental office.
Absolutely, yes.
I mean, if you're doing work on somebody and things are not quite going right, you can always say, come back next week.
Right.
Right? Have you ever done that?
Yes.
Yeah, you say, well, come back next week and we'll finish up, or I'll see you in 2 weeks and we'll finish up. We can't do that. Patients are not going to stick around 2 weeks and come back to finish it up. So that's the number one difference. So that adds an extra level of stress to the work that's being done. And that's not to say that you and I are super stressed out during the day. It's just that we know that our work has to be at a certain level.
Right.
And it has to be completed. And it really doesn't matter what the clock says. It doesn't matter if the clock says it's almost 5 o'clock, almost 6 o'clock, almost 7 o'clock. We have to get the work done.
Yeah, we had that experience today.
Yes, we did.
So.
Both of our patients had situations that just took us longer than we anticipated. And, I think the dental assistants are the ones that suffer the most.
It's very difficult, very stressful dentistry. And, they're traveling from quite a ways away, a few hours away. So we have to make sure, even in our provisionalization, that it's going to hold up. And we don't want a patient...
That's a big word. Wait a minute.
Provisionalization.
Say that again.
Provisionalization.
Provisionalization. I'm not
up.
even going to ask him to spell it.
So,
what is that?
So, for example, we're doing a bridge, and we're cutting off, for example, today we cut off an old bridge on a patient, and we were concerned there might be mercury silver fillings underneath. And also the bridge was made of porcelain and metal. So with our biologic approach, we cut the bridge off. Now, conventionally, in a conventional practice, that patient may be a local person that may live 10, 15 minutes away. So you put a temporary on, and they call you next week and say, my temp popped off.
Oh, well, no big deal.
Yeah, so that's what a provisional is, a temporary.
Temporary.
And no big deal, but when a patient's 3 or 4 hours away,
it is a big deal.
We have to make sure that stays on there. So we use a different type of cement, and a cement that's harder to get off when we take that provisional off, and just adds to the the technique and the stress of the procedure. So.
So that's the number one difference. That's one of the differences. Everything has to be done just right. Also, conventional dentists, many of them do root canals.
Yes.
Okay, so because they do root canals, I'm not going to come out and say that they're flippant or lackadaisical about their work, but if decay is deep, they can very quickly come to the point in the exception that, you know what, I think this patient's going to need a root canal on this tooth. Well, doing a root canal is not an option for us.
Mm-hmm.
So we have to be even 10 times more careful removing the decay. We use something called a biomimetic approach, which means that we remove the decay around the periphery, very gradually and slowly coming to the middle of the tooth where the nerves are. We have to be very careful not to touch those nerves, because for us, root canal is not an option. And so if the person has decay that is so badly that it's going to go into the nerve of the tooth, we're very upset about that. We don't ever want to see that happen. So our approach is a little bit different. Mm-hmm. Like I said, we do biomimetic dentistry, which means we would clean out the periphery, the outside of the tooth first very carefully. And then as we get closer and closer to the pulp horn, the very tip where the nerve is, we might actually leave a little bit of decay there. I know to some dentists out there, that sounds like heresy.
Mm-hmm.
Okay.
Right.
But it now has been proven that you can ozonate a tooth with just a little bit of decay. I'm not saying a lot of decay, just a little bit of decay. You can ozonate that tooth and kill all of the germs and then go ahead and fill the whole thing and save the patient literally thousands of dollars and the suffering that comes along with having a root canal done.
Yeah.
So that's one of the second big differences between a biological dentist and a conventional dentist. So what do you think, Derek? Can you think of anything else that separates us from conventional dentists?
Well, the third thing is something that we find that's common in our profession is we critique each other's work.
Oh,
right?
Dentists are great at that.
So we try to be very careful, but a lot of these patients are going to be going back home to their dentist for follow-up treatment, whether they're going to be making, if we're doing multiple tooth extractions and of root canal teeth or the unfortunate loss of a tooth. A lot of these patients are coming back and they're going back to the dentist for...
They go back for cleaning sometimes or whatever. They go back for cleaning.
For basic maintenance.
That's right. And then so then it leaves... we're on the chopping block.
Yes.
I hear you. That is true. We're on the chopping block. Dentists are very good at critiquing each other. I mean, when I was in dental school, we used to say we police each other. Mm-hmm. Kind of made it sound like that was a good thing.
Right.
We police each other. And I've been in dentistry now, gosh, over 40 years. I see it more like we eat each other. You know, we kill ourselves and we eat each other, more than just policing each other. Usually, if there's a problem with the state board, it's usually from another dentist that critiqued your work and didn't like it or critiqued my work. I mean, I had a patient complain to the state board because I said the person had 6 cavities. And they went back to their home dentist, and their home dentist said, no, they only had 4 cavities. Mm-hmm. And so, now we're a big uproar. And so I had to actually show the fellow from the state board how to find a cavity. And so we have to give him about a half an hour lesson on how to find a cavity. I said, so you tell me. Take this magnifier and put this in your hand, because I wear magnifying glasses.
Yes.
I said, put this in your hands and take a look at the x-rays and tell me how many of those dark spots do you see. He counted 7. I said, you're absolutely right. There were 7. I said I had chosen not to fill one because it was small. And so here you have, I'm saying one thing, the other dentist is saying another thing. Right. It really puts you, the consumer, in a very confusing and very awkward position, because you got to have to feel out and see who's telling the truth.
That's right. And that's why a lot of times we refer, when we say we're Huggins, we've been blessed to be trained by Dr. Huggins. And we refer our patients to the Huggins protocol. Right. And so, because some patients will call our office, and for whatever reason, sometimes we're too far away or they can't get in soon enough.
Right.
And they say, well, just had a call the other day. patient was going to look for a dentist in her providing network. We said, okay. Be sure that they follow the Huggins protocol.
Right.
And she said, what does that mean? And we explained that to her, and she says, you know what? I'll be giving you a call back if I find that this office isn't doing it. So,
sure enough, you got a call back.
So hopefully next week we'll see.
Yeah,
but
we'll
that was
see.
this week before we...
We'll see. So we got a couple of differences here between conventional dentists and biological dentists, and specifically those who follow the Huggins protocol. It's almost as if, there are people who follow the Jewish faith, and then there's Orthodox people who follow the Jewish faith. There are people who are Christians, and then there are Orthodox Christians, and usually the term Orthodox means a little stricter. And I think it's that way with holistic dentistry, don't you think?
Yes, you find all different.
Yeah, there's a lot of people out there. Yeah, they call themselves holistic dentists, and they're just mercury-free dentists. They do not put in mercury fillings, which I'm very grateful for. I'm hoping I see the day when there is no mercury being placed anywhere. But that doesn't make them holistic or biological dentists.
That's right.
No, there's a big difference between the two. You're going to say something?
No, I was just agreeing with you on that case.
Yeah. So we got a couple of differences. Number one, the holistic biological dentist is going to be very careful about removing decay. The holistic biological dentist knows they're going to be critiqued, so they're very careful about their work. And biological dentist is going to be very careful about not pulping out or creating something called having to create a root canal, and not having to do that.
That was one of the things I was going to add to that you had mentioned before. We like to, when we get close to that pulpal area, sometimes we'll switch to a real slow speed.
That's right.
Really slow speed handpiece.
Right.
With a lot of water. But the advent or the inception of biomimetic dentistry has helped to, with the ozonation of the tooth.
Right.
We can still do that, but we don't have to go as far as we did before.
Right. So Dr. Derek and I, we practice very conservatively. We like to leave as much tooth structure as we possibly can. You really won't see us crowning or putting an onlay on a tooth unless we absolutely have to. And there's not much tooth structure because, what most people don't realize is that the tooth is alive. Yeah, it's hard. Like this table is hard. But at the microscopic level, it's more like a sponge. There's tubules and there's protein and all kinds of fluids passing back and forth. It's very much alive.
It is.
It doesn't like getting cut. So, try to be conservative.
Or covered over top because you're ruining the circulation.
That's right.
Which is something we never really thought about in the conventional dental education that we've had.
Right.
So.
And once you put a metal crown on a tooth, the fluid can no longer flow from the inside of the tooth to the outside. I think that was Dr. Steinman. That was it.
Yes.
It was Dr. Steinman who discovered that the fluid flow goes from the inside of the tooth to the outside of the tooth, just as your skin is evaporating fluid right now. Yeah, I mean, I'm not sweating, you're not sweating, but we are losing fluid. And Dr. Steinman realized that fluid goes from the inside of the tooth to the outside of the tooth all the time. If you put a metal crown on top, it stops. It doesn't happen anymore. Do you ever notice when you take some of these old crowns off, the tooth is rubbery underneath?
Yes.
It's like, feels like silly
or it can
putty.
Be very spongy.
Very spongy, and it's just not a healthy situation at all. I mean, that's what I experienced even today, cutting off some of these crowns.
Yeah.
Very mushy underneath. So that's our discussion for this evening. I know I'm going to get some flack from conventional dentists, but I always do. I'm getting used to it. Right. Have a good evening.
Thank you for watching another installment of Today's Dentistry with Dr. Blanche Grube. The goal of our program is to educate you, the patient, in all aspects of the Grube-Huggins Holistic Dental Protocol and how it offers you dentistry that is safe for the whole body. Educate yourself. Watch the other informative and new patient videos right here on our website. Then call for an appointment at the Grube Clinic.